With any stroke, time means saving brain cells, so every minute counts. So it's critical to get into the hospital as soon as you know that you have those symptoms. And for a wake-up stroke, it means calling right away and getting into the hospital by EMS because time matters to you.
When we talk about stroke, most of the time is ischemic stroke, which is a blockage of a blood vessel to the brain that causes that part of the brain to be starved of oxygen. If the brain is starved of oxygen for a long enough period of time, then it undergoes cell death. Over 2 million brain cells die per minute. So whether or not they return to the life that they lived before or whether they die from their disease is purely dependent on how quickly we can get to them and treat them.
At Sentara RMH Emergency Room, we see stroke patients probably every day. With wake-up stroke, usually more time has gone by, so in the past we haven't really been able to treat those patients. And now we actually have the capability of treating the wake-up stroke patient too, which is great, just because stroke is such a devastating thing for patients.
The day leading up to was Christmas Day. I spent with my family. I felt great. Came home, my boyfriend had spent the night, and he wakes me up, asking me if I'm getting up to go to work because my alarm had been going off for so long. And I got up and attempted to get to where he was, and I couldn't. He knew immediately what was going on. He called an ambulance, and they took me to RMH, and then I was taken from RMH to Martha Jefferson.
When Kelly first came in, she could not talk to me. She could make some sounds, they didn't really make sense. She had weakness in her right arm. The entire right side of her face was drooped to the point where someone who knew her would not recognize her.
They identified the fact that she was having a large stroke. She had bad symptoms. She had a large blockage, a large area of brain that was at risk for having a stroke, but that she had a very, very small area of completed stroke with the majority of the affected brain still alive and salvageable. Took her directly from the CAT scanner down to the interventional suite, which is our image-guided operating room, and performed the procedure. Took from the time she left the CAT scanner to the time we had her clot removed was somewhere on the order of about 25 minutes. For the patients that qualify for wake-up stroke treatment, it's life-saving, life-altering, because we see these patients get so much better because of what we can now offer them.
I was in the hospital until Thursday. I think the following Tuesday or Wednesday, maybe, I called Dr. Gaughan's office and I'm like, look, I'm ready to go back to work. I'm bored. So the following Monday, which was 2 weeks later, I returned to work.
So just seeing her now, a few weeks after the incident, is amazing. You know, she's just walking down the hallway, smiling. That's why we do this job right there.
The improvement is almost immediate. It's pretty phenomenal to see what happens when that clot's removed and, that blood starts flowing and the brain gets that oxygen and all the nutrients and things that it needs, and the body recovers. And for these patients, these stroke survivors, it's just such a significant change for them. And as healthcare practitioners and those people caring for those patients, it's just so rewarding. I mean, seeing a stroke survivor recover like that is the reward that we get.